Hello, everyone. It's February the 22nd, Monday. Again, our numbers continue to decrease and continue to look better, but we've lost 15 West Virginians over the weekend, and it's 15 too many, but it's 15 a whole heck of a lot better than where we've been. Our 2,249th death is an 83-year-old female from Mercer County. Our 2,250th death is a 61-year-old female from Raleigh County. Our 2,251st death is an 88-year-old female from Cabell County. Our 2,252nd death is a 75-year-old male from Gilmer County. Our 2,253rd death is an 87-year-old female from Logan County. Our 2,254th death is a 60-year-old male from Fayette County. Our 2,255th death is a 69-year-old female from Logan County. Our 2,256th death is a 73-year-old male from Cabell County. Our 2,257th death is a 75-year-old male from Kanawha County. Our 2,258th death is a 71-year-old female from Monongahela County. Our 2,259th death is a 75-year-old male from Monongahela County. Our 2,260th death is a 74-year-old male from Hancock County. Our 2,261st death is a 77-year-old male from Logan County. Our 2,262nd death is a 71-year-old male from Kanawha County. And our 2,263rd death is a 75-year-old female from Kanawha County. 15 people. More than Sago. And we are cautiously optimistic that it's surely a whole lot less than it was. 15 people that I ask you every day to please remember in your thoughts and your prayers, and these people do not need to become a number. Please, please remember them and all their loved ones, because these people are really grieving right now. And please let them know you're with them. In the last 24 hours, our new positive cases have dropped to 238. Our daily positivity rate is at 4.84. Our cumulative rate has dropped again to 5.1 or 5.51. Our active cases are now down to 8,795. That's 36 straight days that we have dropped. We have, and now get this is unbelievable. You realize, it's been a long time since November. This is the first time that we have been below 9,000 active cases since November the 12th. That's good. Our recovered cases are 118,796. You can see there on the top graph how it continues to widen, and that's wonderful. We're down to we have 294 people that are hospitalized in West Virginia and 80 in the ICU units, and we do not have a red county in the state. And if you'd put that state map up, that'd be really good. We're getting better. We're getting better, West Virginia. I want to tell you this, there is one of the things that I proposed in the State of the State was the elimination of our state income tax. Over time, the first step will be getting rid of as close to half of it as we possibly can. And then as we go forward, I am a real believer that our growth could very well take us there without raising any other tax whatsoever. It will be a net savings to us all, and a real opportunity for those that are really struggling in our state to pull out of that and get a job that will actually pay you more money. And that's what I want to do more than anything. I want to cast a lifeline to those people that are really struggling to absolutely have an opportunity to pull out of that. And I want to bring all kinds of people to West Virginia. So starting today at 3 o'clock, I'm going to do a virtual town hall meeting right here just like we are. So all of you that are tuning in right now, please tune back in. I'm going to take as many questions as I can, and I'm going to do this repeatedly across the weeks, and absolutely until I am confident that all the people out there truly understand what I am embarking upon. Now, with that being said, I'll take any question that you call in and you're able to ask, and I look forward to being with you, and I will tell you every single thing I know. Not to profess that I know everything about this topic, but I know a lot. I'll probably be joined maybe by our revenue people, and I'm not sure about that right yet. But the bottom line of this is we need to quit running around and people being told things and impact of this and impact of that and everything. This is an opportunity for you to ask and me to absolutely directly answer your questions to the very, very best of my ability. So I truly think just this, if you'll just step back from this and just think this way. And I'll tell you more about this later on, but this is all about an opportunity. An opportunity for our state beyond belief. An opportunity that is dealing with half of the revenue within this state. An opportunity that gives us the ability to go down, measure where we're at. If we don't need to go any further, we don't go any further. Or go on further, and absolutely measure again. But this gives us the opportunity to do just this. Go to all these states. Just think. It drives people here. Now is the time more than you can imagine. West Virginia is now the spotlight of all kinds of people across our country, if not across the globe. Now is our moment, and we've got to seize that moment. So join me at 3 o'clock. Let's all get up to speed. Let's cast out all the taboos that are out there, and let's get up to speed. And I'll do the very best I can, and I promise you I'll tell you the absolute truth. And I know you've been with me all the way on where we're at right now, and I trust that once you really truly understand this, you'll be right with me on this as well. On Friday, we lessened restrictions. We increased the capacity of all the restaurants and bars to 75% of their seating capacity only. We raised the capacity limitation on our small businesses and retail stores from 2 per 1,000 square feet to 4, and the grocery stores from 3 per 1,000 square feet to 6. We raised the social gathering limit from 25 to 75, and I called upon the state board in regard to making it mandatory to go back to a 5-day-a-week in-person instruction at our schools, K through 8th, and still let our color coding dictate us on 9 through 12. I've asked the SSAC to work with our county school boards to ensure that they have occupancy rules and or attendance limitations for winter sports, that are going on right now, providing that the social distancing requirements are there and in place. I've also clarified the live music performances except for those incorporating vocals or wind instruments may take place indoors so long as the event is held in accordance with the applicable guidance documents. We may, and just as a shot across all of our bows, we still may, if things slide back, and we've got to be fluid in what we do, we got to be able to pivot, and if things slide back, we may very well have to reinstate restrictions and on the businesses and stuff like that, like we've already done. It's mandatory to wear your face mask indoors, in public buildings, at all times, and unless you're eating or stuff is on our website. A vaccine distribution update, we hit 101.3% of our total administration rate for our first and second doses. Our goal is always 100%. We're knocking it out of the park in every way. Now we have put shots in arms of 435,942 West Virginians, and that's a total of first round and second round. We continue to lead the nation over and over and over, and we have special thanks that always go out to our counties and our communities, all the DHHR, all the National Guard, all those that are making this happen in every way. We thank you beyond belief. You know, as far as our scheduling system, you know, all that stuff is online. Again, now we really need some special help, you know, from additional counties to get people that are, you know, pre-registered. Now, these counties are broadened, and that's not good, but we need special help to get people registered from Mercer, Mingo, Wayne, Mason, Jackson, Monongahela, Mineral, Morgan, Berkeley, and Jefferson counties. So especially up in the Eastern Panhandle, come on now, you guys really got to get pre-registered, you know, as well as different places throughout our state, but I'm going to read it one more time. That's in Mercer, Mingo, Wayne, Mason, Jackson, Monongahela, Mineral, Morgan, Berkeley, and Jefferson counties. We need you to really get after getting our people, your people in those counties pre-registered. Since we've launched this pre-registration, we've now registered 279,000 West Virginians plus or minus, and that's really good. And if you still have trouble being able, you can't really go online and do it, just call us and we'll walk you through this. It'll take about 10 minutes, and that's all there is to it, and it'll really help you to be able to get in line and get the shot when and have someone communicating with you as to when that's going to happen. As far as our Saving Our Wisdom clinics, we're in all 55 counties. You know, we want to absolutely push everybody age 65 and above to check out all the stuff. We don't have enough vaccines still to do everything, but names are being pulled from the wait list, and we got to get you, you know, pre-registered, and we're working really hard to get all of our West Virginians 65 and above, you know, vaccinated. If you'll just think about just what I just read today, I read through this list, and I think the youngest person of the 15 that died was 60 years old, I'm sorry, 60 years old. Please know this is all about age. So far, and this is the number that I talk about all the time and just tickles me to death, 149,684 individuals of 65 and older have now received their first shot. 77,413 have gotten their second shot. You know, there's no question whatsoever we saved a bundle of lives there. You know, the vaccine info line's up there. Reminders about the vaccines is get your vaccine. You cannot possibly be so stubborn as to not get your vaccine. Absolutely, all across the land, we see nothing but positive. Get your vaccine, West Virginia. You've got to get your vaccine shots. In the meantime, the best thing you can possibly do as far as prevention is your mask. All of our testing sites are up there. All the stuff, you know, about getting tested, it's all free. You know, our drive-through pharmacy stuff, really good. We thank Frith and we thank Walgreens all the time. We have had 3 confirmed variant cases found. They were all found in the north central part of West Virginia. You know, 42 of our 50 states across this country have now reported, you know, variant cases. The DHH has collaborated with Western University and Marshall to conduct whole sequencing, which is going to be used to detect this variant or these variants, and everybody's on this, working it in every way. I do think you'll have to hear from Dr. Marsh more about that, but I think he'll tell you that the vaccine is helping with the variant situation as well. So, but we'll refer to him in just a minute on that. We have 19 outbreaks in our long-term care facilities. That's less than it's been forever, almost. You know, we have 2 outbreaks now in our churches. We've gone back up. We've still got the one in Fayette County, and we picked up one in Webster. You know, we want to, again, thank all of our church community. You've done fabulous work. Stay on top of this. Keep the pew in between you. Keep the social distancing. Wear your mask. And if you're older and everything, maybe it's a time to skip a few services and everything. And so you'll have a whole lot more services in the future. You know, as far as corrections, you know, we now have 6 inmates all across the state of West Virginia and 11 staff cases in the entire state. It's amazing. Absolutely amazing. Great work, people. You know, as far as the face covering requirement and all that, we all know about this and everything, but you know, this right here is the lifeblood to you. Wear your mask. Give blood when you can and everything, especially if you've recovered from COVID. It's a blessing from God above, and in my opinion, you should feel like it's somewhat of a, you know, of a requirement almost, because you know, if you've recovered from this and you can give blood, I really believe you should be doing that. You know, as far as your emergency response, and a great big thank you that goes out to a lot of people, I want to send that big thank you to all the workers who are continuing to respond to the damage from the winter storms last week. You know, we in West Virginia, gee, many Christmas, you know, we have responded to so much, and yet we continue to just step up, do we not? Our first responders, our police and our fire and our EMS and our DOH crews, the National Guard, the power companies, the Division of Emergency Management, the utility companies, the volunteer organizations, my heavens to Betsy, and it just goes on, and I apologize if we've left somebody out, but nevertheless, I thank you all from the bottom of my heart. If you're one of those that we happen to leave out or whatever, just subscribe to this theory. My dad used to do everything he did, he wanted to do it anonymously, and it drove us all crazy almost. And I said, Dad, everybody knows. What in the world are we doing, Dad? And he said, listen, Jimmy. He said, if I know and the good Lord knows, that's all that really need to know. And, you know, and because in his book, that's all that matters. He didn't need a bunch of credit. You know, really and truly, that was my dad. So, you know, if you know, and the good Lord knows if you're helping, someone would happen to leave your name off or whatever like that, I thank you from the bottom of my heart. But if we've missed you, but with all that, subscribe to what my dad thought, because that's how he thought. Anyway, that's all I got. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good morning. To reinforce a few things that the governor said in his comments, over the weekend on Friday, really, we described the first 3 cases of a new variant that is in 44 states in the United States, which originated in the United Kingdom. And as we've talked about, this variant, as well as other variants, are really naturally occurring what's the word I'm looking for? Outcomes of the virus that is replicating, making mistakes. And so as we know, these variants are important in causing potentially a little bit more easy spread than some of the other COVID-19 viruses that we've seen in the past. Now, the good news about the United Kingdom variant is the fact that the vaccines we have appear to be effective against this variant. We know that masks and physical distancing work just as well to reduce the spread of this variant as it does other forms of COVID-19. And it is also good news that we have been able to put together a team that has worked together to facilitate and help us have the ability to do whole genome sequencing on this virus. And I'd like to recognize for leadership Dr. Laura Gibson from our innovation team at WVU, our partners at Marshall University, Don Primorano and Jim Denver, our colleagues at West Virginia University, Dr. Peter Stoloff, Dr. Peter Parada, Ryan Persifeld, Wes Kimball, Dr. Sally Hodder, and Dr. Michael Hu, and also our state leadership, including our epidemiology lead, Shannon McBee, Christy Clark, and many others. This collaboration is really a demonstration of the great talent we have in the state. The fact that we are scrappy and resilient and have put together the capabilities to do much for ourselves. And having this capability now in West Virginia will facilitate and allow us to track very closely any new outbreaks to see if the variant viruses are responsible, to be able to survey and surveil the state as far as positive tests so that we can follow that very closely, and also be able to help the CDC with identification of these types of variant viruses that might occur in West Virginia. I also want to reinforce, lastly, what the governor asked, and you saw the state map that asked people in certain counties, particularly people that are over 65 years old, to go ahead and really make sure that you pre-register in our state surveillance system, pre-registration system. We know that these vaccines turn out to be even more powerful than native infections in protecting you from being infected with any form of COVID-19. And so we really want everybody over 65 years old to choose to be vaccinated. Remember what the governor said last week. If we look at the first 6 weeks of 2021, we see over the first 6 weeks a 72% reduction in the number of deaths from COVID-19 on a weekly basis. We see hospitalizations, ICU admissions, and ventilators as low as we've seen them since October, November in 2020. So our strategies and your good work is really making a difference. And so we really want you to be pre-registered, particularly our over 65-year-old part of our population, so that we can get immunization to you. And again, we hope that you choose to be immunized when you have the chance. And please, please, please continue to wear masks and physically distance. Even though we've been able, through the governor's leadership, to start to open up certain things a little bit more than we have, it does not mean that we should not keep our guard up as much as possible. So as we enjoy these new liberties, this reducing the focus of constraint in the state, we still need to become really careful because we're not out of the woods yet, but we've made a lot of progress. And that's really thanks to you, West Virginia. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor pointed out, we had another good week despite significant weather challenges, over 101%. This week, we will be cleaning up challenges that we encountered from last week, and we believe we will have an exceptionally strong week this week. As, for example, the federal pharmacy program, the Walgreens doses coming in will actually be twice the amount for this week to recover from last week's. They will be running clinics Wednesday through Monday, so we'll see significant increase in effort there. We continue to work and look at our data and balance loads. We know that there are some counties that are concerned that they may not have a higher rate of dosage than others. We are working that diligently. The governor has given us the guidance and the direction and the challenge that we are all going to cross the finish line at the same time. So this week we have 28 counties that we will be balancing loads out on to make sure that we're equal in our distributions across the state. We also are seeing some increase in dosage. For example, the National Guard is receiving doses federally from the Department of Defense to do our National Guard members. We're working with U.S. Army Corps of Engineers in a clinic today for doses for their employees that are coming from National Department of Defense numbers. We are working with numbers with the Veterans Administration because we know a number of our veterans have received their vaccination through the VA hospitals. So all those continue to increase our numbers of people in West Virginia vaccinated, and we'll continue to work to meet those challenges. Thank you.
All right, thank you, sir. Dr. Aina Amjad and Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Marsh, could you tell us a little bit more about what the researchers at WVU are doing to identify the new variants? Tell us a little bit more about the genomic sequencing process and what we can learn from that.
Commercial and the state DHHR teams. And what we've done, just like we have looked at developing the capabilities to do PCR testing in the past and antibody testing and working with the National Guard to be able to identify the right fit for masks and gowns and the N95 West Virginia mask. But what this consists of, Charles, is to be able to move to being able to sequence the DNA, the genome of COVID-19 virus. And what this consists of is to be able to identify each base pair in any virus that we look at so that we can not only detect the United Kingdom variant, which is made up of a number of identified mutations, or the South African variant or the Brazilian variant, but we can look for any kind of mutation, any kind of genetic change, and we can start to link that then to any kind of outbreaks that we might see that may be a bit unusual. People may be reinfected who have previously been infected with COVID-19 or larger outbreaks. So we are very much now capable in a very sophisticated way to be able to monitor very, very closely the types of viruses that exist in West Virginia as we'll look, and we'll just do surveillance on a certain number of viruses, but also we'll be armed in a different way than we have been in the past to be able to really specifically identify what is the virus that's causing a particular set of clinical observations, perhaps, as I said, an outbreak, and be able to do that in a way where we can track it. We can then identify the people that might be infected with it, and we can really very quickly isolate those people and prevent the spread. So this is a really great capability, and we owe a tremendous amount of gratitude to our great scientists and universities who are leading this effort.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, this may be a question for you, or maybe a question for General Hoyer or Dr. Marsh, I don't know. But on the DHHR website, where it talks about the timeline for administering the COVID vaccine, it says that the general population will start receiving vaccines beginning in March in phase 2. Now, if you drill down into that and continue on to the PowerPoint program that you put together, obviously it starts general population with older residents, et cetera, not really getting to what I would call the entire general population until I believe 2C is the phase of the program. So, Governor, when can we expect an upgrade and an update on the PowerPoint program, which many West Virginians go to for their information, that would make it more clear when the average Joe and the average Jill can expect to roll up their sleeves in West Virginia and actually get the vaccine? Thank you.
Okay, Kenny, let me start, and then I'm going to defer to General Hoyer. But Kenny, the very thing you're talking about there, I've said it over and over and over, and that is just this: is there was a day about a month and maybe 5 weeks ago now. And on that day, we decided to go back to school, K through 8th. We decided to not leave vaccines set on warehouse shelves, and we decided to move right then to an age deal. And at that point in time, you're exactly right. You know, most of our seniors are probably sitting there thinking, well, people are dying everywhere, and I'm really not probably going to get my shot because I'm in the general public, and I'm probably not going to even think about, you know, being able to get my shot until what looks like it could very well approach the 1st of April. And a lot of us are going to die. An awful lot of us are going to die. And I may very well die, you know, if I'm that senior and I'm thinking about it. So we restored real hope, and we moved, and we pivoted 5 weeks ago. And I just read you where we've gotten in the arms of 149,000 of those people that 5 weeks ago we published that because that's what we were told is the very best we could do. And that's where West Virginia started to race to the front like we've done over and over. 77,000 people, in addition to the 149, 65 years of age and older, have gotten a second shot. We've absolutely been through all of our nursing homes, and we've gotten all them their shots and their second shots. And without any question, this all stems back to just the fact that this is all about age. And we've seen our death rates spiral down, and that's absolutely what we wanted to have happen. But General, maybe you could take it from there. But Kenny, what a day that was. What a day that was, a collaboration of all the people that are on this call right now, and plus some others in the education field, and what a day it was. A day really and truly that will be remembered for a long time to come. General.
Yes, sir, Governor. Kenny, as the Governor pointed out, our focus has been on age, and it's led to that 72% reduction in the first 6 weeks of our death rates, and hospitalizations below 300. I think if we go back and look, our documents, I believe, showed a March through October timeline based on availability of federal supplies. So it would be within that window of March through October. We'll continue to try to give clarity to our citizens in the state, and obviously it's all based on supply. If things continue to progress with federal supply increases, we'll be able to do more people more quickly, and we are prepared and could on a daily or weekly basis do 135,000 vaccines easily. So we'll continue to make sure that folks are aware of that timeline from March through October, and hopefully it will be shorter. It will be March through July, depending on availability of federal supply.
All right, thank you, Kenny. Next, we'll go to Mark Curtis with the Next Star Media.
Good morning, Governor and staff and cabinet members and fellow members of the press. This may be premature in asking, but what has contact tracing taught us or told us about these variant cases up in the Morgantown area? And without violating HIPAA or anything, can you tell us, were these students, were these people who had recently traveled out of the country, or again, in general, what if any contact tracing has been done, and what has it told us?
Dr. Marsh or Dr. Amjad, y'all take over.
Yeah, do you want me to take this, or do you want to?
You can go ahead, Clay.
Okay, sounds good. Thank you, Mark. What we have found so far is that there is a commonality to the individuals that have been identified, which is 3. And it doesn't look like that there's been any interaction with the campus component of the university. I believe it was documented that there was there at least 2 of these individuals have a connection with the university, but haven't been on the main campus. And we're investigating this as we would investigate any other outbreak. And as you know, as is particularly important here, is we want to make sure that this virus stays as limited as possible. And if it's limited within a small cohort, then that can be controlled. But I think it's important also to note, Mark, that we know that this variant is increasing. 44 states in the country are defined having the United Kingdom variant, and I think 14 states with the South African variant and fewer with the Brazilian variant. So this is just all a manifestation of the evolution of COVID-19 infection. And while this is a new finding for West Virginia and one we take very seriously, we know that the inevitability, as we've talked about the whole time, is this is a very dynamic process. So instead of trying to figure out how we're going to affect, COVID-19 in the next 6-8 months, we are constantly watching, we are constantly inquiring, following, investigating, and we continue with the governor's leadership to make the decisions in an agile and flexible manner that we believe does benefit the health of the residents of the state of West Virginia. And I think we'll do this again. So people should be not scared of this. This is just part of the unfolding of this virus, but we have the capabilities to be able to track this, which is important, and we're tracking this actively now.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning to everyone on the call. This is to the medical folks. Recently, Dr. Marty Makary from Johns Hopkins wrote an op-ed in the Wall Street Journal saying that by April, we could be approaching or at herd immunity. I want to know if you agree with that assessment, and what sorts of things would you consider an indication that we are at herd immunity?
Dr. Marsh, go, please.
Thank you. Thank you, Paul. So herd immunity by its definition, which given the reproductive value of this virus and the variants would be in the 80% range, is probably not going to be achieved in its classic sense, because we know there's a lot of children that are present in the US who right now the vaccines have not been absolutely tested on. So although we may see, the Pfizer vaccine, which is 16 and older, emergency use authorized, the Moderna is 18 and older. So we won't likely reach herd immunity in that way. What's really interesting though, and I think gives us a lot of optimism, is some of the data that's coming out of New York and some other places where there's been higher incidence of infection with antibody levels that have been documented, that combined with immunization. When you get to the 40–50%, even though it doesn't give you herd immunity, it does appear to slow down the transmission of the virus, which may be what we're seeing now, that combination of vaccination plus mask wearing, plus people that have previously been infected. I also think it's really important to note that emerging evidence is showing around the world that a single dose of the Pfizer or the Moderna vaccine or the Johnson & Johnson vaccine, which has not been Food and Drug Administration approved yet, seems to have a fairly significant impact on protecting us from severe disease, hospitalization, and death. And so even a single dose, as we've been very aggressive in West Virginia, particularly in older West Virginians, may be causing that protection, which we're seeing this substantial reduction in death and hospitalization rates.
All right, thank you, Paul. Next, we'll go to Suzanne Elliott with the Dominion Post. I think we may be having trouble with the connection on Suzanne. So next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. It's been reported on social media and traditional media that at least a couple of legislators are, I suppose, mocking the mandatory mask requirement by wearing masks that appear to be just made of straps around their faces. Can we get some comments on thoughts on this behavior and what they should be doing?
Well, Phil, I'll take this dead head on. You know, this Capitol is a public building. You know, and if they're doing that just to you know, as you know, purposefully, you know, mocking or making a mockery of our mandate, that's no good. And you know, I want to be respectful of everyone, but at the same time, you know, they absolutely know the right thing to be doing is wearing their mask and be proud to be doing it, because they're setting an example for the people. And that's if that be the case, I didn't know anything about it and everything. I'll check it out and everything, but that's not good.
All right, we'll try one more time with Suzanne Elliott from the Dominion Post. Suzanne, are you here?
Yes. Hi, I'm a bit of a technology troglodyte here. Quick question. I've been reading that the UK variant is expected to become the dominant strain in the US in the coming months. Should we expect that in West Virginia as well, as you said, as the virus unfolds?
Dr. Amjad and Dr. Marsh, that's y'all again, but you know, I would add just this. Don't anybody think because they can look out the window and see a mountain or whatever, you know, that we're protected or immune here. That's anything but the case. You know, we're just like everybody else. But Dr. Marsh or Dr. Amjad, please answer.
Do you want to take this one?
Sure. Suzanne, just as we stated before, anything's possible. We don't like to make, you know, predictions. There's a lot of unknown, but at the same time, it's possible. And the UK variant is very contagious. And just like the other states, we're seeing an uptick in the UK variant. So we do want to remain cautious and vigilant. So that's why we are asking everyone to wear their masks and take this serious. So just as the governor mentioned and Dr. Marsh has mentioned, you know, we've seen 3 so far in West Virginia. So it's possible that we'll see more in the state. So with that being said, we want people to wear their masks, take it seriously, and it's possible that we'll see more in the state of West Virginia. But that being said, we just need to stay vigilant and hopefully continue to do the best we're doing so far. Thank you.
All right, thank you, Suzanne. Glad we got you connected. Governor, I'll turn it back to you.
Well, I'm pretty good today, you know, from the standpoint of I haven't made any notes, you know, on anything that's come up that I felt like I needed to, you know, come back to, except one is I want everybody to remember, you know, that the most important economic thing that has come down the pike in a long, long time is this, you know, personal income tax, and I'm going to be talking to everybody about that at 3 o'clock. So tune in and share with me your questions and concerns, and I'll try to address them. But nevertheless, you know, I just would congratulate all of our medical team and all those at the Guard and everybody that's doing an amazing job, all the health people out there all across the land that have really, really made us all help pull the rope together. I thank all of you West Virginians because what you're doing is amazing. It is amazing work, and we hate like crazy we lost 15 great West Virginians today or over the weekend, but we're going to absolutely show these people that we care, and we're going to say our prayers and in hopes that they'll get through this, and I'm sure they will, but I don't play that off as being any easy stuff. We hate like crazy. We've lost these great West Virginians. We've lost some additional wisdom, but we're going to keep at it because that's what we do. That's what made us great, and that's what we're going to continue to do. Thank you so much. God bless all of you. Thank you.